My name is Diana Herrera. I'm going to be performing a head to toe.
Come in.
Hi, how are you? My name is Diana, and I'm going to be your nurse today. We're going to be doing a head to toe assessment in which I'm going to be checking your head to your toes, so everything on your whole body. Are you okay with that?
Yeah, that's fine.
All right. Can you please give me your name and date of birth?
Yeah, Javier Doe, January 1st, 1988.
Thank you. So what I'm going to be doing now is I'm going to be starting to obtain health history on the patient. After I get his health history, which is the subjective data, I will be doing obtaining the vital signs. I will observe while I'm doing the health history. I will observe his skin color, his nutrition, his personal hygiene. I'll also observe his posture, also his physical, if he has any deformities, his mobility, his facial expressions, the mood. We'll also be checking on his hearing, so every time that I talk to him, and then also in his articulation and any contact. So we will interpret anything that he was saying and his speech on that. Okay, so from the scale to 0 to 10, can you tell me your pain? 10 being your worst pain.
No pain, 0.
0?
Mm-hmm.
Okay. And then I'm gonna ask you some couple questions. Do you know where you are?
Yeah, I'm at the hospital.
Do you know what day is today?
December 8th.
Okay. Do you know who's the president?
Donald Trump.
Those glasses are for prescription?
Yeah, prescription.
Prescription glasses? Do you have any hearing aids? Any hearing deficiencies?
Mm-mm.
Nothing?
Nothing.
Do you have any difficulty with swallowing?
Mm-mm.
No? Do you wear any dentures or any implants on your teeth or anything like that?
Yep.
Any discomfort in chewing or difficulty chewing? No? Okay. So right now I'm gonna ask you 3 words. I'm gonna tell you 3 words. You're gonna remember them, and then at the end of the assessment, you're gonna tell them to me.
Okay.
So it's gonna be cat, dog, and cow.
Okay.
All right. Okay. So now I'm gonna be going to ask you we're gonna start touching, and I'm gonna start with the assessment. Is that okay with you?
Yeah, that's fine.
Okay. Okay, so we're gonna start with your assessment. So, can you please remove your glasses?
Mm-hmm.
So the first thing I'm gonna be doing is I'm gonna be assessing the skin. So all the skin has to be, and every time that I'm inspecting each part of the body, I'm gonna check on the skin. I'm gonna check on if it has any parts that it has like any lesions or any masses when I'm palpating, and also I'm gonna feel for the temperature, any thickness or turgor. Also, I'm gonna be checking on those things. So I'm gonna start with the head. I'm gonna start palpating the scalp, the hair, the cranium, making sure that he is symmetrical, that he has any masses or any injuries, as I mentioned before. And then I'm gonna look for the any distributor pattern. So we're gonna palpate. I'm gonna check also if he has any lights or any, since he has a beard, so I'm also gonna check on his beard, and I'm gonna check the symmetry of his eyes, making sure that he has symmetry, that his eyebrows and his whole face. So while I'm palpating, I'm actually gonna ask him to. So I'm gonna actually I'm gonna ask him to, I'm gonna check cranial number 5. So I'm gonna check up on the temporal. I'm gonna ask him to bite with your mouth closed, please. And then I'm gonna feel his mandibular bone. And then the trachea. Okay. So cranial number 5 is good. I'm also gonna ask him about performing, can you smile for me? Can you frown for me? All right, can you blow your chest? All right, perfect. So everything seems intact and symmetrical. That's cranial number 7, which is the facial. I'm actually gonna check on cranial number 2 now, which is gonna be the visual acuity. So with my pen, I'm gonna check on cranial number 2, which is the optic. I'm gonna check on any constriction. Perfect. I'm gonna go on the other one. Can you keep your eyes open, please? Okay, so now what I'm gonna be doing is I'm gonna be checking. I'm gonna be checking cranial number 3, which is the ocular. We're gonna be checking on the pupil size, so I'm gonna make sure that the pupils are the same. They're the same. The equality, the round, the reactiveness. So we already checked on the reactiveness with the light, and it was perfect. I'm gonna tell you to track down the pen. Perfect. So his visual view is good. Without covering you one eye, I'm gonna put a number. Look at my eye right now.
2.
Okay, the other one.
1.
Perfect. So we're gonna right there we check out also number 4 and number 6. With the pupils also I'm gonna actually check on his feel. So keep looking at my pen. Ready? Perfect. All right, sounds good. And then I'm gonna move to the next one. So now we're gonna actually check on his ears. I'm gonna inspect the entire ear. I'm gonna the outside, the sternum, to see if they have any drainage, if they have any tenderness. Does it hurt?
No.
When I touch here? No? Also, we're gonna check on the mastoid bone, which is right here on the back. Does it hurt?
No.
Let me check the other one. Some situation. Any tenderness?
No, nothing.
On the tragus and then the mastoid bone. Nothing?
No.
Alright, good. So I'm gonna check now cranial number 8, which is gonna be the acoustic. I'm gonna whisper. Can you cover this here? Or I can do it for you.
Dog.
Good.
Dog.
Good. Perfect. So the whispering on both ears to try to make sure, and it seems like everything is good and he could hear it. Now I'm gonna move to the nose, which is the symmetry. So I'm gonna check on the nose, make sure that he doesn't have any lessons on it. Touch it, palpate it first. After palpation, I'm gonna he doesn't have any deviation. I see a little bit, but it's pretty good. It's a normal. Now I'm gonna actually check on his olfactory with an alcohol swab. So I'm gonna go get it. Okay, so I got something else because we actually don't have any alcohol swabs. So I'm gonna ask him to smell it, and normally you wanna try to get something that smells good. So patient, so what does it smell like?
Like lavender.
Yeah, it's perfect. It's lavender, so it's good. So that means that you are perfect. Now we're gonna go to the next one, which I'm gonna be checking on the mouth. So what I'm gonna be doing is with the pen light, I'm gonna be inspecting everything on the tongue, teeth, the gums, the palate. So can you please open your mouth, please? Perfect. I'm gonna check in any lessons, anything on your mouth. Say ah for me. Ah. And you see how the uvula goes up. That means that cranial number 9 and 10 is working. I'm also gonna ask you to move your tongue side to side. Perfect. And then I actually checked for his soft palate and his tonsils. Everything looked good. Now I'm gonna say, I'm gonna check on cranial number 12, which is the hypoglossal. Can you please take out your tongue out and move it side to side again for me? Okay, that's number 12. Perfect. And then we're gonna move to the next one. So now I'm gonna check number 11, which I'm gonna be checking with the neck. I'm gonna inspect for the symmetry. So the symmetry of the neck right here. You wanna actually check for and palpate for the trachea. Make sure that the trachea is straight. You're also gonna palpate for the lymph nodes. Alright, so what I'm gonna be doing is I'm gonna be palpating on the cervical nodes, lymph nodes. So I'm gonna work myself from the jawline to the front. And then I'm looking if I'm able to palpate any of the lymph nodes, that means that the lymph nodes are swollen. So I'm gonna also check on his neck and for any inflammations or any swollenness. Since I don't feel any swollenness, I'm not actually touching the lymph nodes. That means that it's normal and he's okay. So we're gonna move to the next one, which I'm actually gonna, after I'm gonna do that, I'm gonna actually palpate the carotid pulse in both sides, and it's one at a time. Perfect. I'm able to do it, and it's +2. It's very strong. I'm also gonna auscultate it for anything, and then I'm gonna auscultate it with the belt. Alright, perfect. I'm also gonna make sure that the trachea is in the midline. I'm gonna explain the thyroid gland, and then I'm gonna ask, can you please swallow for me? Perfect. So I'm checking on number 10 by asking him to swallow on the biggest. Now I'm gonna check on 11, which is I'm gonna ask him to, can you straighten your shoulders? Perfect. Alright, can you move your head this way, please? Can you move your head that way? Perfect. Can you open your mouth? Perfect. So I'm asking the number, which I'm checking on the spinal accessory nerves to make sure that that he has the same amount of resistance in both arms and that he has a strength. Now I'm gonna also have the patient. Can you move your head up and down? Perfect. That covers all number 11. So now we're gonna be inspecting the chest. So we're gonna be doing the lungs and the heart. So can you please remove your t-shirt, please? So now I'm gonna be checking the chest symmetry. So that both sides of the chest are equal. That his expansion of his chest. Also gonna observe his breathing and his facial expression. Also I'm gonna palpate for any masses or tenderness. So, sir, can you sit down for a minute? Okay, so we're gonna check on his crepitus masses, any tenderness. I'm gonna actually check on his back that he doesn't have any tenderness. Do you have any pain?
No.
No? Okay. So I'm gonna be listening to your lungs first. So every time that I touch you with the stethoscope, please take a big deep breath.
Okay.
Okay, Now I'm gonna check your back. Can you please place backwards for me? Thank you so much. Okay, so now what I'm going to be doing is I'm going to be assessing the tactical firmness. So I'm going to ask the patient to say 99, 99. I'm going to actually put both of my hands, and then I'm going to feel the vibrations of my hands. So
99, 99, 99, 99.
And then by doing so, I'm checking to see if any of the vibrations are different, and as I feel it the same, so therefore it's okay. So now we're gonna be auscultating the heart. So what I'm gonna be doing is, thank you patient, I'm gonna turn around. I'm gonna actually be auscultating for the aortic, the pulmonic, Hertz point, the tricuspid, and the mitral. So first I'm gonna check my diaphragm, and then I'm gonna get to the aortic point, which is gonna be on the second intercostal. Perfect. Then I'm gonna move to the pulmonic, which is on the other side. Perfect. I'm gonna get to Hertz point. Then I'm gonna move to the tricuspid. And then I'm gonna move to the mitral, which is the highest point of impact. And it sounds pretty good. After doing so, I'm actually gonna check with the bell. So I'm gonna turn it around to check for any murmurs. So I'm gonna go again to all the points. So tricuspid, the aortic, aortic, pulmonic, Hertz point, tricuspid now, and then the mitral. Everything sounds good. I'm actually checking for the S3 and S4 on those areas, and then to the murmurs with the bell. All right, now we're gonna move to the next one, which is gonna be the upper extremities. I'm gonna see if they have any signs of any lessons. So would you come a little closer? Thank you very much. So I'm gonna check if if he has any signs of lesions or like any injuries in the skin, breakdowns, anything like that. Her distribution. I'm actually gonna check on the capillary reflex. So I'm gonna actually check on his fingernails, and I'm gonna check for. So I press it for some time, and then his capillary reflex are good. I'm also gonna check for any tenderness and range of motion. So it seems good. Also gonna check, can you push down? Push up. Good. Can you press my hands? Perfect. So I'm trying to check for his strength. Everything seems normal. So now what I'm gonna do is I'm gonna actually check on his radio pulse. And he seems good. And then I'm gonna check on the other side. I'm actually gonna check on brachial pulse. It seems perfect. Alright, so all his everything looks perfect on the upper extremities. So now we're gonna move to the abdomen. Okay, so now what we're gonna be doing is I'm gonna be checking the abdomen. I'm gonna be inspecting and looking for any scars, the contours, the symmetry. May you remove your teacher, please? Thank you. So we're gonna check and inspect. May I touch you?
Yes, ma'am.
Okay, so we're gonna make sure that we are checking on the abdomen, that he doesn't have any scars, any lessons, the symmetry, and then the reflex. So now I'm gonna be auscultating the abdomen, and then what I'm gonna be doing is I'm gonna be auscultating for any bowel sounds. I'm gonna go over it with the diaphragm. So we're gonna start on the lower quadrant to the upper quadrant. Alright, perfect. And then I'm not really gonna be doing this for around go over the area around for 5 minutes. I'm also gonna be now hearing for the auscultating with the bell. I'm gonna be checking on the arteries. So the first one I'm gonna check on is the aorta. Then I'm gonna check on the renal ones. Then I'm going to be checking on the iliac. Then I'm going to be checking on the femoral. Alright, so after checking on the arteries, I'm gonna percuss the 4 quadrants. So I'm gonna start on the lower. Alright, do you have any pain?
No,
No?
no pain.
Now I'm gonna be actually palpating. First I'm gonna start with the light palpations all around the stomach. Then I'm gonna go to deep palpations. Alright? Do you feel any pain?
No.
From the scale of 0 to 10.
0, no pain.
So now I'm gonna move to deep.
No pain.
Let me know if you have any pain. Okay. So then after that, what was your last bowel movement?
Today.
What time during the day?
In the morning.
In the morning. And then do you have any difficulties, any constipation, anything like that?
No.
No? What about your urine? Is it normal?
Yeah.
Yeah? And then do you have any burning sensation, any discharge, any discharge from your penis? Nothing?
No.
Okay. Are you sexual active?
Yep.
Yes? How many partners?
1 partner.
Okay. So when we check in on those, make sure that you're taking care of yourself while you're performing sexual activities. Also, we make sure if you was a woman, we also ask for the menstrual period. And then the urination, if they have any burning sensation or anything like that, because that will be indication of UTIs. Alright, so now after that, I'm going to check on the tenderness and the rebound of the stomach and of the abdomen. And it seems pretty good. So now we're going to move to the lower extremities. So what I'm going to be doing is I'm going to be checking for his pulse. So I'm gonna be checking for the radial pulse bilateral. Okay. And then now I'm gonna be inspecting the lower extremities. So what we're gonna be doing is I'm gonna start with if he has any less breakage or any injuries, breakdown in the skin, if his hair is distribution is okay. I'm gonna check for any redness. So it seems all okay. So I'm always inspecting that part. Then after that, I'm gonna start going with the pulses. So I'm gonna start with the femoral pulse. Then I'm gonna start with the popliteal pulse. Then I'm gonna move to the dorsalis pelvis. Then I'm gonna go to the posterior tibial. And then I'm gonna check on the capillary refill of the toes in the nail area. And it seems pretty good. I'm gonna check in both feet. Perfect. After that, what I'm gonna be doing is I'm gonna be doing some range of motion. So I'm gonna ask the patient to actually, if he could actually move his feet down, put in some pressure, good. And then move your feet up, good, pretty good. So I'm doing the strength test. Also, I'm gonna be checking for any tenderness, and then I'm gonna check for the Babinski reflex. So you feel the discomfort?
Yeah.
Normally he will have a reflex, so he will have like a flexion on the toes that is normal. Also, I'm gonna ask him to stand up, so that way we could check how the patient walks across the room. Check his access on his balance and gait. So can you please stand up, sir? Okay, so now what we're gonna do is we're gonna ask the patient to walk across. So you're gonna stand up, and then we're gonna measure on his balance, his gait, and so please just walk. And then we're looking at his balance and his gait from walk and walk. Also, we're gonna perform the rumble test. So what I'm gonna be doing is you're gonna be touching your heels together. Perfect. You're gonna cross your arms right here. And then for 30 seconds, he's gonna be looking at a straight point. You're gonna be looking, open your eyes, and then you're gonna be looking at a straight point for 30 seconds. So he's gonna stay like that. Then after that, we're gonna check for any imbalances, anything like that. Then we're gonna tell him to close his eyes, and we're gonna do it for 30 more seconds. So close your eyes, and then we wanna make sure that he's keeping his balance, that he's staying in place. We could actually give him a little push, just in case, but he seems like he's controlling his balance. He's staying on the same place. Once we see that the patient is not doing that, then we will stop the test. Also, we're gonna test for sensation with the cutting. I'm gonna be actually touching you in different areas. We're just gonna feel for him to have any reflex on the sensation of touching. We're gonna use that in different areas, and then you're just gonna tell me where did I touch it. I'm gonna do it in your hands, legs, face, around the areas. Okay? So, can you please put your hands like this? Close your eyes.
Left hand, right hand, forehead, middle of the forehead, left leg, right leg.
Okay, so that was perfect. That means that he has a light touch and sensation. Now, before I finalize the test, can you please give me the 3 words that I told you at the beginning of the test?
Dog, cat, and cow.
Perfect, sounds good. So, do you have any questions for me? We have finalized the head to toe now. Do you have any questions?
No question.
Any concerns?
Mm-mm.
You have your like button here.
Oh.
If anything that you need, you could just give me a call. And then I'll assist you with anything. Okay?
Alright.
I'm gonna be documenting now the abnormal findings, and then I'm gonna be actually leaving the room. Anything else that I could do for you before I leave?
No.
Do you
that's it.
have everything that you need? Perfect. So I will be removing my gloves and performing hand hygiene, and this finalized my last part of the head to toe. So thank you so much and have a wonderful day.